I have cystic fibrosis. Cystic fibrosis is the UK's most common life-threatening inherited disease. In the UK it affects around 9,000 people. 1 in 25 people is a carrier of the faulty gene that causes cystic fibrosis. And if 2 carriers have a baby, there's a 1 in 4 chance that the baby will inherit both copies of the faulty gene and get cystic fibrosis. Cystic fibrosis causes a build-up of thick, sticky mucus in the lungs and digestive system, which makes it difficult to breathe and digest food. And it means that my lungs have always got infection in them. And every day I have to take antibiotics and do physiotherapy to clear thick, sticky mucus from in my lungs to try and keep my airways as clear as possible. Over the course of the day I take around 30 tablets and I do approximately 2 hours physio. In the morning when I wake up, I inhale hypertonic saline through a nebulizer, which helps to loosen the mucus, and then I do breathing exercises. If I'm really well, that can only take maybe 20 minutes. When I'm unwell or have a chest infection like I do at the moment, that will take well over an hour. I take these tablets in the morning, so antibiotics, vitamin, antibiotic, antifungal because I have aspergillus growing in my lungs, tranexamic acid to help clotting when I cough up blood, enzyme tablets to digest my food, and then this is an antibiotic that I do through my nebulizer to help fight against Pseudomonas. At lunchtime I then take the antibiotics and enzyme tablets again. In the evening I go running as a form of physiotherapy, which gets rid of the thick mucus from in my lungs. If I'm unwell, like at the moment with a chest infection, then after I've been running, I'll then have to do another hour of physiotherapy and breathing exercises. This is it's called an acapella, and it's like a flutter device, and when I breathe into it, it sends a little vibration in my airways and helps clear the mucus. In the evening I take these tablets with my dinner, and then before I go to bed I do the antibiotic nebulizer again, and then later on I always do this one just before I go to bed, which is DNase, and it helps to break down the strands of DNA in my mucus. That's when I'm well, and when I'm unwell, or when about every 3 or 6 months when we decide to have intravenous antibiotics, I have to do a lot more treatments, and the next video clip will show you what that involves. At the moment I have a chest infection, so I'm on a course of intravenous antibiotics. These antibiotics have to be injected 3 times a day. I'm on 2 different types of antibiotics, and one of them I have 3 times a day, and one of them I just have once a day. Altogether, including preparing and mixing the antibiotics and then administering them, it takes over 3 hours a day, additionally to all the other treatments that I have to do. A lot of people with cystic fibrosis have these treatments in hospital. I choose to have the treatments at home because I prefer it than having to stay in hospital for 2 weeks. Luckily I've got a very supportive family. My parents helped me by preparing the antibiotics. So I have my first dose at about 6 o'clock in the morning. The next dose when I get home from work at around 3:30, and then I have another dose at around 10 o'clock at night before I go to bed. So when I'm on the antibiotics, you have to be really sterile and wash your hands with a special hand wash and use alcohol gel, and make sure that we keep this area very, very clean. Because I have a portacath, so this tube goes to a needle, and the needle goes to the special device under my skin, and then there's a tube that goes straight to my heart, so all these antibiotics and things that I'm injecting go straight into my bloodstream. So it's really, really important that we're very cautious and extremely sterile to make sure that I don't get an infection. One of my best friends, Tamsin, has decided to run the London Marathon to raise money for cystic fibrosis. We've been friends since university, and she also came to New Zealand with me to go travelling. And within 3 days of her arriving and us setting off on our adventure, I was admitted to Auckland Hospital as I had double pneumonia, and so I had infection in both of my lungs and I was really poorly. So I had to spend the first 10 days of our trip on intravenous antibiotics in hospital. So Tamsin's been with me through a lot of difficult times, and she's seen firsthand how hard it is to live with CF. And she's chosen the Cystic Fibrosis Trust as her charity, as she'd like to try and make a difference and try and contribute to the research and to the support that they give to people with CF. It would be really great if you could support her by donating to her fundraising page, and there's a link to it just next to this video clip. Thank you in anticipation for your donations.